I asked ChatGPT, how do you fix varicose veins? AI seems to have an answer for everything these days, from what to eat to how to stay healthy. So since I'm an expert in how to fix varicose veins in real life, I wanted to see what happens when you ask it about medical problems like varicose veins. If this is your first time here, welcome. If you're returning, welcome back. I'm Dr. John Chuback, and I'm a board-certified cardiovascular surgeon specializing in vein problems, varicose veins, and people with lymphatic disorders as well here in northern New Jersey. Today I'm reacting to what ChatGPT says about fixing varicose veins. And I'm telling you, this is going to be a real reaction. I'm going to see what ChatGPT said, and then I'm going to tell you what I thought about it. We'll look at whether the advice it gives is medically accurate, what it gets right, and where it misses key details. If you've ever searched online for ways to treat or even cure medical or health-related issues, this will help you to understand what's real, what's risky, and what modern-day practice actually supports. So let's see what ChatGPT has to say about varicose veins. It said, varicose veins can't be cured without treatment, but they can absolutely be managed or corrected depending on how severe they are. Well, that first statement sounds very good to me. That's true. Venous insufficiency, which leads to varicose veins, is a chronic and progressive and incurable disease, but it can definitely be treated and managed and maintained. So far, so good, Chatty, as a friend of mine likes to call it. Here's a full breakdown. Number one, start with lifestyle changes for mild cases. These can reduce symptoms and slow progression. Exercise regularly, walking, swimming, cycling, or leg lifts improve circulation. I like this advice so far. This is conservative treatment for early venous insufficiency and varicose veins. Nothing crazy or out of the ordinary here. Number two, elevate your legs 15 to 20 minutes a few times a day. This helps to allow blood flow to go back to your heart. Well, while this is true, in practical application after 20 years of taking care of varicose veins, I find that that advice is probably not that applicable to the real world. I don't have too many patients who can take 15 to 20 minutes a few times a day, which to me means 3 or more, to help blood flow back to your heart. But it's not a bad thing to do to elevate the legs. Key is there, I've talked about this in other videos, to make sure that the legs are above the level of the heart. So the legs have to be up, heart has to be down here. Sitting in a chair, like I'm sitting, let's say right now, with my legs elevated or extended on the coffee table or on a footrest of some kind doesn't count because the heart is still above the legs. But elevation of the legs is valuable. It's just that it's not that practical. Maybe in the evening while watching TV, something like that. But 20 minutes 3 times a day, most of us are too busy for that. Avoid long periods of sitting or standing. Move every 30 to 60 minutes. Again, good advice, a little impractical. We do say it, there's no question, but most of us sit or stand at work. As a surgeon, that's all I do. I sit at my desk in between procedures. I go in to do a case and I stand the whole time at the operating table, at the procedure table, and then I go back and sit at my desk again. I do take a few steps between my office and the operating theater or the procedure room, but it's not very much. Most of us cannot lay down on the job. It's a good way to get fired generally, so I wouldn't suggest it. I do, in my practice, try to take a 15-20 minute walk. If there's a break in the action, I have a little break in my schedule, and I do recommend people do that. But again, most of us have to sit or stand basically all day at work. The next advice that ChatGPT gives is to wear compression stockings. This helps push blood upward and relieve heaviness or pain. I agree with that. The thing that it's left out there is that they should be graduated compression stockings. Generally, we recommend 20 to 30 millimeter mercury compression, meaning that there's more pressure at the ankle and it gets progressively less as it moves up the leg. And that really helps to move blood. So specifically, graduated compression, ideally 20 to 30 millimeters of mercury pressure for most patients with varicose veins. So just a regular compression garment or compression sleeve or a tight stocking, which is not a medical grade stocking, is not valuable. Maintain a healthy weight. Extra weight increases vein pressure. That's very good advice for a number of medical reasons, just about every medical reason, but varicose veins is no exception. Avoid tight clothing or high heels. These restrict blood flow. That's not something that generally we specialists advise. I don't think that that's backed by that much science. It might make some logical sense, but most people today do wear tight jeans, leggings, and all kinds of different garments, and I don't think that they really restrict blood flow. And the high heel thing, I've heard that before, but I don't think that's a major factor, quite frankly. Now we come to number 2, medical and procedural treatment. This is for moderate to severe cases, it says. If lifestyle steps aren't enough, doctors often recommend one of these. So the first thing I would say is that this is generally recommended for people who are symptomatic or are showing signs of long-standing venous insufficiency or complications. So you can have cellulitis, you could have edema, you could have thrombophlebitis, you can have a deep vein thrombosis, you can have pain, you can have night cramps, Charlie horses that wake you from sleep. Generally, it's based on symptomatology, how the patient is feeling, or signs that they're having complications that's affecting their skin and circulation, not just the fact that you have more veins or less veins. So that's one key distinction there. The first treatment they talk about is sclerotherapy, which is injection therapy. It says best for small to medium-sized veins. There are caveats there, but generally that's good advice. It says how it works. A chemical is injected into the vein. They use the word chemical. I would use the word medicine, I think is a better word, and we do use FDA-approved medications for that. I see some people in the comments after my videos, people say they don't have great faith in the FDA, but certainly, generally speaking, I do, and I would prefer an FDA-approved medication injected into my body or a family member's body or anybody that I cared about. So it's a medication, not just a chemical, is injected into the vein, causing it to scar and to close, and the body reroutes blood through healthier veins, and that's generally correct. Number 2 is what they call endovenous laser ablation, or endovenous laser therapy, EVLA or EVLT, or radiofrequency ablation, RFA. And these are thermal treatments. It doesn't quite say that here, that these are heat-related treatments to basically heat shrink or burn the bad vein, cauterize the vein. And yes, these are very commonly done, but generally not for varicose vein. These are generally done for what we call truncal veins. For example, the great saphenous vein or the small saphenous vein, or any of those other kinds of branches, something called the anterior great saphenous vein, for example, not for the varicose veins themselves. So that's a key distinction, and definitely, I would say, generally speaking, a mistake. How it works, a thin catheter delivers heat inside the vein. Again, wrong. It's not the catheter that delivers heat inside the vein. It is either the laser fiber or the radiofrequency probe. It's not the catheter itself. Catheter is just a delivery device that we pass the fiber through. So that's definitely wrong. Sealing it shut from the inside. That's true. That's the idea, is to seal the vein shut. It says the recovery has minimal downtime and it's done under local anesthesia. Generally, both of those things are true. You might go someplace where they recommend sedation or even general anesthesia. I would strongly suggest against that in most cases, but largely what they said there is true. The third treatment they talk about is microphlebectomy, also called ambulatory phlebectomy. This is where veins are physically removed. And this says best for bulging surface veins, but they don't describe the fact that, generally speaking, almost always the underlying venous problem should be treated first. And that's the same for the sclerotherapy that they mentioned. The underlying source of pressure should be treated first. And now they say how it works. Tiny incisions remove the vein completely. Well, tiny incisions obviously don't remove anything. So this is a mistake also by ChatGPT. I know what they're saying, but they've got it wrong. Tiny incisions are made, and through those tiny incisions, we use a surgical, what's called a vein hook, and that vein hook grabs the vein under local anesthetic, or what we call tumescent anesthetic, and it's the hook that actually removes the vein. It also doesn't necessarily remove the vein completely. We can remove segments of bad veins, and the remaining segments that get left behind will be absorbed by the body. So that's also incorrect in several ways. Recovery says small scars, minimal discomfort. Again, depending on who the surgeon is and what their experience is, there may be no scars whatsoever, but certainly it can leave some small scars, and there is minimal discomfort in the immediate postoperative period, but long-term there should be no discomfort. There should be no pain. Then it comes to the fourth suggestion here, vein stripping or ligation. It says now rare only for very advanced cases when less invasive options fail. I would say that that's untrue. It is very rare, but I wouldn't say that it's for very advanced cases or that when less invasive options fail. I would say generally that's in the hands of people who have not kept up with the most advanced contemporary treatment. I haven't done a vein stripping and ligation in 20 years. I don't think it's really ever necessary. There may be a rare exception for whatever reason, but generally speaking, that's something that's simply not done anymore in competent and qualified hands. Now we come to medications and supplements, dietary supplements like micronized purified flavonoid fraction. This is a plant-based compound shown in clinical studies to reduce leg swelling, heaviness, and pain by improving venous tone and lymphatic drainage. I totally agree with this. For full disclosure, some of you may know, I started a dietary supplement company called VitaSupport MD, and we actually produce MPFF-based supplements for that exact reason. And I think that many patients with symptomatic venous disease do benefit from MPFF therapy because it supports normal venous and lymphatic drainage and function. So I think that's excellent advice. Then they discuss horse chestnut extract. As you see, I'm looking at this just as we go. Horse chestnut extract may help mild swelling, though less evidence than MPFF. I agree with that. A very good dietary supplement. We do have a product that includes horse chestnut. There's a lot of research on horse chestnut. Probably not as strong as MPFF, but strong. Horse chestnut, I believe, is a good dietary supplement for people with venous and lymphatic health concerns, and they want to support their health and wellness. I think it's great. And it also supports hemorrhoidal health and wellness very much, and many studies have been done to show that also. Then this says, always check with your doctor before taking supplements, especially if you're on blood thinners. Interesting. I always agree that with any of the information we share in these videos, always check with your doctor, healthcare provider, pharmacist, etc. But that being said, I am not aware, and we've looked at this very carefully, I'm not aware of any risk of taking MPFF or horse chestnut with blood thinners, but you can look at that. In fact, there have been some studies that showed MPFF and blood thinners help people more than either one alone for people who have certain vascular issues like post-thrombotic syndrome and things like that. So I would question that advice that ChatGPT is giving, and I would definitely check with my doctor or pharmacist. Next, they say when to see a doctor is if you have persistent swelling, heaviness, or pain in the legs. I would agree with that. That's very good advice. Skin changes like darkening, itching, and ulcers. Definitely, I agree with that. Those are those signs and symptoms of chronic venous insufficiency and varicose veins that you want to be aware of. And it's at that point the patient should certainly look at undergoing treatment, whether it's conservative or interventional. Veins that become hard and tender, generally that's what we call phlebitis. That's when you have superficial thrombosis or clotting in the superficial veins, and certainly that's something to look at. Studies have shown in the past that when somebody has superficial thrombosis, what we call thrombophlebitis, or a clot causing inflammation in the superficial veins, as many as 1/3 of those patients might have also a DVT along with it that they're not aware of. And that DVT can actually be in the opposite leg. So if you get hard, tender, red, painful varicosities that seem to be inflamed and clotted off, see a doctor right away for evaluation. It could mean something even more dangerous. You know, that's going bit by bit. That's Dr. Chuback's honest reaction as I saw it coming at me. And I think generally ChatGPT did okay. It's clearly not perfect. There are some real mistakes. There are some things that aren't well explained. I feel like my profession, my job is safe for the moment. I don't think ChatGPT is going to replace me or any of my colleagues in any of their respective fields of specialization anytime soon. Not a bad place to get an overview and a sense of what's going on, but nothing replaces the care that can be provided by a board-certified physician and other health professionals today, nurse practitioners, physicians, assistants, people who are well-trained, well-educated, and knowledgeable about what's going on, especially specifically in their field. The other warning I would give you is if you have a specialized problem, get to a specialist. I love my primary care physician colleagues. They're brilliant, they're great, they're effective, but no one can know everything. And unfortunately, I see patients all the time with significant venous disease who need care of one form or another and are being told by their primary care doctor that varicose veins are simply a cosmetic issue. And that is absolutely incorrect. That is false information. So always get yourself, whether it's your thyroid gland, whether it's your varicose veins, whether it's your heart, your skin, whatever, get to a specialist so you can get the advice of somebody who's doing something something over and over every day for many years and wants to provide you with the best possible care. I'm Dr. John Chuback, board certified cardiovascular surgeon. I hope you enjoyed this video. I hope you'll subscribe, and I hope you will ring that bell for notifications and like this video, and also share it with friends who you think may benefit from this. Thank you so much. I'll see you in the next one.